So when it comes to diagnosing coronary artery disease, we often think of invasive angiography, catheters, contrast injections, fluoroscopy. But here is the most interesting fact. A computer tomography coronary angiography, CTCA, computer tomography coronary angiogram, CTCA, can visualize the coronary arteries with over 95% accuracy without ever entering the body. That's the right. Absolutely. It's not invasive, high resolution, 3D look at the coronary vessels, allowing us to see even early atherosclerotic plaques long before they cause symptoms of ischemia. And some very interesting articles we've got that even we can, well, actually, I don't know how to trust or not to trust, but we can find unstable plaques. This is the vulnerable plaques. Unstable plaques that provoke myocardial infarction. We know that unstable plaques, this is the problem. This is the problem. Okay? Stable plaques is not a problem at all. So, it's not invasive, high resolution, 3D look at the coronary arteries. So, CTCA uses multi-detector computer tomography combined with iodinated contrast to capture detailed cross-sectional images of the heart. With advanced reconstruction algorithms, it produces stunning 3D images of the coronary arteries within a single heartbeat, literally watching the heart in motion. What it makes revolutionary is not just its diagnostic precision, but its preventive power. Traditional angiography can only see the vessel lumen, the hollow where blood flows. But CTCA shows the entire arterial wall, allowing us to identify non-obstructive plaques, the ones that may rupture and cause sudden myocardial infarction. That is why CTCA is often called the crystal ball of cardiology, and it can detect the disease before it strikes. So CTCA, actually, I repeat, I'm not absolutely sure, can we trust or not? But there are some real interesting articles that say that yes, we can detect unstable plaques, vulnerable plaques that provoke myocardial infarction. Maybe, by the grace of Jesus Christ, could it be like this? Because classic coronary angiography is all that we can see, stable big plaques that provoke problem. So clinically, CTCA is most useful for patients with chest pain of uncertain origin, intermediate pretest probability of coronary artery disease, and exclusion of coronary artery disease in low-risk patients where it can safely prevent unnecessary invasive procedures. So I repeat, CTCA useful for patients with chest pain of uncertain origin, intermediate pretest probability of coronary artery disease, and exclusion of coronary artery disease in low-risk patients where it can safely prevent unnecessary invasive procedures. Another fascinating and very interesting point, the Scott Hart trial demonstrated that adding CTCA to standard care in patients with stable angina reduces the rate of fatal and non-fatal myocardial infarction by 41% over 5 years. Question, why classic angiography provokes problem of fatal and non-fatal myocardial infarction. That's why classic CTCA shows us what? Reduce the rate of fatal and not fatal myocardial infarction. Why? Think about that. So it's not a question that Scott Hart trial, yes. CTCA reduced the problem. The problem that we have to understand, that classic coronary angiography increase the rate of fatal and fatal myocardial infarction. That is the logic, that is the point. So, okay, take-home messages is this, my beloveds. CT, coronary angiography isn't just a diagnostic tool, it's a window into the future of preventive cardiology. It allows us to see disease in its silent stage, intervene early, and ultimately save lives before symptoms even appear. Think about this message to you. Please, my beloveds, stay blessed.